Hi, my name is Tina, and today I'm going to present about a topic which is related to hazardous manual handling. Introduce the overview of what I'm going to discuss through this presentation. So what is the definition of manual handling? Manual handling tasks refer to an activity that requires a person to carrying, pushing, lifting, pulling, putting, or otherwise holding, moving, or restraining an object or a person by hand or bodily force as an example of repetitive movement, bending, twisting, reaching, awkward or persistent posture, sudden or high force, and also exposed to vibration. Conversely, hazardous manual handling could happen everywhere in healthcare setting, and most staff have to perform a variety of handling and moving tasks every day. Yet, maintaining a good level of patient independence and mobility is very important in delivery care, as it would reduce the amount of risk, also the impact on long-term physical and psychological outcome for both patient and healthcare staff. Been facing in healthcare setting. In healthcare industry, manual handling has been recognized as the high-risk activity that can result in serious injuries of both patient and healthcare staff during the transferring task. However, it can be quite challenging for healthcare staff if they attempt without training or having adequate equipment to transfer the patient. And it will put patient at risk of fall, shoulder decollation, head injury, or skin tear. Way manually lift patients will also put themselves at risk of having musculoskeletal disorder, which commonly cause of injury ranging from strain to sprain of the back, causing lower back pain, sore neck, pain around shoulder, and pain around wrist or knee, etc. Accidents that have been occurred lately in the workplace environment, there are three strategies that have been used to improve on manual handling, include manual handling training, risk assessment and management, having safety huddle at the start of the handover. It's about manual handling training. Training should be part of overall strategy that can reduce the number of incidents associated with hazardous includes the needs of an appropriate measurement of the specific group patient. For example, patient at risk of fall or pediatric patients. Staff need to be instructed on the safety use of equipment. Knowledge and skill taught of using equipment need to be updated. Provide appropriate information and instruction of how to use the equipment in an appropriate way. Training should be include the result of risk assessment. Risk assessment and also focusing on the problem solving as well as the practical skill. The second strategy would be risk assessment and management. Managing work health and safety risk is an ongoing process and the need of critical skill. However, there are 5 risk assessment processes that are commonly used in healthcare workplace include identifying hazard and risks, which means that the healthcare staff need to identify on the material, equipment, or substance used, physical work environment, work tasks, and how healthcare staff perform their skill during the day of work. Secondly, assessing and analyzing the risk, which means that staff have to find out what kind of action that can take control over the risk, have to find out how severe the risk is, and how urgent the action need to be addressed. Thirdly, it is about controlling and eliminating the risk, which means that staff have to considerate about the hierarchy of risk control. Next is about documenting, finding, and reviewing the task control, which means that all risk assessment tasks have to be reviewed in appropriate time frame and need to be updated frequently. Lastly is about communication and assessing, which means that all organizations, include employees, should be documenting the risk assessment and communicating findings for safety health workplace. However, safety hurdle can also become a strategy that can help healthcare staff to discuss with their manager about the significant safety and quality issues, in which to identify hazards, assessing risk, and implementing control to minimize risk of safety workplace. Additionally, the brief meeting can integrate in clinical area prior to begin at the start of the shift to discuss the concern about the patient and the working environment, which includes safety incident occur, environment or equipment safety issues, staff concern in relation to patient safety. For example, high risk for patient, confused, agitated, or aggressive patient. How can effective leadership resolve and mitigate the problem of hazardous manual handling? Effective leadership always demonstrates their behavior that help others to achieve the common goal, as they always encourage people to take personal responsibility, always encourage the all level of healthcare staff to show their commitment, always raise awareness and promote exchange of ideas, and always involve healthcare members in decision making. And reduce the number of incidents that would occur in healthcare setting. Manual handling tasks are always potential source of injury that associate with risk. So the best practice for healthcare staff is to encourage the patient to wipe bear themselves. If they can't, the equipment might be required. So patients that the staff are being handled may increase the risk of injury. For example, on their physical characteristics include their height, their weight, their strength, their size, their medical condition, etc., their level of consciousness, the unpredictable behavior, the willingness to help, and also the communication and understanding. Throughout the reason that mentioned before, the FU strategy that can reduce risk associated with manual handling include mobility risk assessment, the use of sling lifter, provide adequate resource or supervision to avoid risk to staff who is working under the pressure and time management. Also plan ahead of how to handle a patient who are attached to medical equipment. What is my responsibility as the new graduate nurse to educate my peer about self-practice manual handling? To educate my peer worker about self-practice manual handling, as the new graduate nurse, I have to actively communicate and try to promote the local health policy for them to practice through, and maintaining communication between staff and patient when delivering care in the community. For example, always asking for consent and provide dignity or respect to the patient. Explaining the procedure to the patient before transferring to make sure that the patient can understand what we are trying to do. Then monitoring the effectiveness of risk control by using correct use of manual handling. For example, always check the equipment before use, know the capacity of equipment related to patient height and weight. For example, size of the sling. Hazardous manual handling can be preventable if healthcare staff can get more access to training, get more access to the resource about the safe use of manual handling. Always follow up the New South Wales Health Policy guidelines and always maintain the scope of practice so that the cause of incident would not be occurring on patients. This is the end of my presentation. Thank you.